Today we're talking about the deadly side effects of painkillers. We've all seen the headlines about addictive painkillers, but the truth goes far beyond that. Even the ones we don't think twice about can lead to devastating heart attacks, kidney failure, and more. Maybe you take one of these yourself. They're sold over the counter, prescribed by doctors, and marketed as safe. But are they really? So by the end of this video, you'll understand which painkillers carry the greatest risks. I'll also share some safer alternatives and precautions if you are going to take these drugs. I would recommend you watch until the very end, because you'll also discover powerful strategies to relieve pain naturally, potentially sidestepping the need for dangerous medications altogether. First, let me ask you, ibuprofen is harmless, right? Now, most people don't think twice before taking NSAIDs, or non-steroidal anti-inflammatory drugs. That's things like ibuprofen, naproxen, or aspirin. But these drugs can cause serious, even deadly side effects. One of the biggest risks is heart attacks and strokes. In fact, this study suggests that regular NSAID use can increase the risk of a heart attack by up to 50%. Even short-term use, just a few weeks, it can raise your risk. This happens because NSAIDs disrupt the chemicals that regulate blood flow, making blood clots more likely to form. So if a clot blocks an artery in your heart or brain, the result is heart attack or stroke. And it's not just people with heart disease who need to worry. Even healthy young people have suffered sudden heart attacks from overusing NSAIDs. Then there's the damage to your stomach. NSAIDs can strip away the protective lining of your stomach if you use them too often, leaving you vulnerable to ulcers and internal bleeding. And of course, your kidneys take a huge hit too. NSAIDs reduce the blood flow to your kidneys, which can lead to kidney failure. Dehydration magnifies the risk, so make sure you drink plenty of water if you do take an NSAID. The golden rule with these drugs is to never use them for more than 10 days in a row unless instructed by a doctor. If you do use them for mild everyday pain, we'll discuss some better options later on. Next up, we have a particularly nasty one, oxycodone. If you live in the US, you already know about the oxycodone scandal. It was supposed to be a medical breakthrough for pain. Instead, it turned into one of the worst addiction crises in history. But what most people don't realize is that the addiction is just one piece of the problem. Even if you take oxycodone exactly as prescribed, it can still wreck your body in ways that are rarely talked about. And one of the biggest hidden dangers? Increased pain sensitivity. That's right, this painkiller may actually make your pain worse over time. It's called opioid-induced hyperalgesia. Basically, these drugs can cause neuroplastic changes in your central nervous system, leading to increased sensitization. The more you take, the more your nervous system overreacts to pain signals. Then there's the hormonal impact. Oxycodone doesn't just dull pain, it suppresses testosterone levels, leading to fatigue, weight gain, low libido, and even depression. Many long-term opioid users develop something called opioid-induced endocrine dysfunction, where their body stops producing the right balance of hormones. And the scariest thing is that it doesn't take years of use for this to happen. It can literally start within weeks. So how did we get here? Well, for years, pharmaceutical companies pushed oxycodone hard. Doctors were incentivized to prescribe it, patients were told it was safe, and by the time the truth was proven in court, it was too late. The US alone lost over 500,000 people to the opioid epidemic. Purdue Pharma and the Sackler family were ordered to pay a total of $7.4 billion in settlements, and yet oxycodone is still being prescribed every single day. If you're prescribed oxycodone, be very careful. Given its addictive nature and potential damage to the central nervous system, it's best to seek a second opinion about whether you really need it, and put as many precautions in place as possible. Now, oxycodone is the one that made the headlines, but it's not the only heavy medication that's been misrepresented. Next up, we have tramadol, the so-called safe opioid. Tramadol is a lower class opioid, meaning it's regulated less strictly. Because of this, some doctors give it out like candy. But be very careful here. A 2019 study in the British Medical Journal found that people prescribed tramadol were just as likely as those taking oxycodone to keep using it after surgery. That is a major red flag because it suggests that tramadol may hook you just as easily as the stronger stuff. And just like oxycodone, addiction isn't the only thing to worry about. One of the scariest things about tramadol is that it can trigger seizures, even if you're taking it exactly as prescribed. And if you mix it with the wrong meds, like muscle relaxers, that risk shoots up even more. As you can imagine, if you're taking a heavy painkiller and a muscle relaxer, you're probably in desperate pain. Most people have no idea this can happen, but it's a real danger. Then there's serotonin syndrome. Tramadol doesn't just work on opioid receptors, it also messes with serotonin and norepinephrine, the same brain chemicals affected by antidepressants. So that means if you take tramadol along with certain medications, like SSRIs for depression, your serotonin levels can spike dangerously high. And when that happens, people suffer confusion, hallucinations, and rapid heart rate, which can quickly spiral into an emergency. The key takeaway here is that just because tramadol is classified as lower risk, don't take it lightly. Because once you start relying on it, it can be just as hard to quit. And it does come with some very serious risks. Next up, we have gabapentin and pregabalin. If you ever get nerve pain, fibromyalgia, or migraines, then the doctor may prescribe gabapentin or pregabalin. They are especially common for people with diabetes, but unfortunately these drugs can cause serious breathing problems. In fact, in 2019, the FDA added a warning to both of these drugs that they can cause severe respiratory depression. That means they can slow down breathing to the point where it becomes dangerous or even fatal. And the risk goes way up if you take them with opioids, alcohol, or other sedatives, have lung conditions like chronic obstructive pulmonary disease, or simply if you're older. What's more, these drugs can increase your risk for deep vein thrombosis by up to 80% according to this study. Deep vein thrombosis is when a blood clot forms deep inside a vein, usually in the leg. If that clot breaks loose, it can travel to your lungs and cause a pulmonary embolism, which can kill you instantly. Now, this problem seems to be the most severe for people with diabetes, but considering that these drugs are specifically given to treat diabetic nerve damage, that's concerning. Next, what's the one drug everyone assumes is completely harmless? That's right, paracetamol, also known as acetaminophen. It's in every home, sold everywhere, and taken for everything from headaches to fevers. And compared to NSAIDs and opioids, it's generally safer. No stomach ulcers, no addiction risk. But here's the thing, it's also the #1 cause of acute liver failure in several countries, including the US and the UK. The problem with paracetamol is that the margin for error is dangerously small. With many medications, you'd have to take way over the recommended dose to land yourself in hospital. But with paracetamol, the difference between a normal dose and a toxic one is surprisingly small. And the scariest part is that you don't feel it right away. Nothing tells you that your body is in trouble. People take a little too much, maybe for a few days in a row, and they feel fine. Then, out of nowhere, their liver fails. So why do so many people overdose? Because paracetamol is hidden in tons of different medications. Imagine someone catches a cold. So they take some cold and flu medicine. Later, their back hurts, so they pop a painkiller. Then maybe a cough syrup before bed. What they don't realize is that all of these can contain paracetamol. When taken together, the doses quickly stack up and can overwhelm your liver. And if you mix paracetamol with alcohol, that's a whole new level of dangerous. Alcohol already puts stress on your liver. Add paracetamol to the mix and the toxic effects multiply. So how much is too much? The absolute max for adults is 4,000 milligrams per day. That's about 4 extra strength tablets spread throughout the day. Don't be scared of paracetamol, be smart about it. In normal doses, it's fine, but remember that it's super easy to take too much. Always check medication labels carefully to make sure you're not doubling up. Look for the words acetaminophen or paracetamol, and never mix it with alcohol. Before we get to the safer pain relief options, is this useful? If so, please click the like button, click subscribe and turn notifications on to see new videos as we release them. At this point, it's clear that most painkillers come with serious risks. Yes, you might need a pain relief drug in certain situations, but the fact is they are way overused. First up, topical patches offer powerful targeted relief. When you swallow a pill, it floods your entire bloodstream with the drug, even though you only need relief in one specific place. Think about it. If you hurt your knee, do you really need pain relief chemicals circulating through your hands, arms, shoulders, and torso? No, you just need it in your knee. That's where topical pain patches come in. They deliver targeted relief where you need it, without flooding the rest of your system. One of the most powerful options is diclofenac patches, also called Flector patches. It's an NSAID, kind of like ibuprofen, but instead of going through your whole body, it only targets the spot where you put it. If you've got arthritis or joint pain, this can be a game changer. Another solid option, capsaicin patches. These are made from the same compound that gives chili peppers their heat, except instead of burning your tongue, it blocks pain signals right where you apply it. These can take a while to kick in, but when they do, it can be great for nerve pain, arthritis, and scar tissue pain. Then there are CBD patches. Many people swear by them for joint pain and inflammation. And if you need something stronger, lidocaine patches might be worth a try. These work by numbing the area completely, kind of like the anesthetic you get at the dentist. They don't treat inflammation, but they can be really effective for nerve pain, sciatica, and shingles. Now, it is important to understand that not every patch will work for every person. If the first one you try doesn't do much, don't give up. Try a different type, because sometimes it takes a bit of trial and error to find what works best for your body. Okay, moving on. Pain relief creams can be fantastic too. Like patches, they work only where you put them. You're not flooding your whole system when you only need relief in one spot. Again, diclofenac is a powerful NSAID-based cream. Then you've got more natural types like menthol and arnica-based creams. Menthol gives you a cooling sensation that helps numb pain, while arnica is more about reducing swelling and bruising. Capsaicin cream is another option. Yep, just like the patches, it uses chili pepper extract to block pain signals, and is especially good for nerve pain and arthritis. But sometimes the answer isn't a pill, patch, or potion at all. Remember when you were a kid and every accident called for a bag of frozen peas? That's right, cold and hot therapy. Cold and hot therapy can be even more effective than medicines in many situations. So when should you use cold, and when should you use hot? The rule of thumb is that if something is swollen and inflamed, like a sprained ankle or a fresh injury, ice is your best bet. Cold numbs the pain and reduces swelling. Ever had a killer headache and put a cold pack on your forehead? It's the same idea. It helps constrict blood vessels and calm things down. Now, when the pain is more about stiffness, tension, or tight muscles, heat is what you want. A heating pad, a warm bath, or even a hot water bottle can increase blood flow, relax the muscles, and loosen things up. If you've ever woken up with a stiff neck and put a warm compress on it, you know exactly what I'm talking about. What about ice baths? They're super popular nowadays because they can instantly neutralize inflammatory pain. But they're not for everyone. If you have any heart problems at all, sudden exposure to extreme cold can be risky. So talk to your doctor first, and if you're going to try an ice bath, make sure someone is at home with you. And finally, don't forget about hands-on treatment like physiotherapy, acupuncture, and TENS therapy. These get to the root of the problem, rather than just blunting the pain. Tight muscles, weak joints, poor posture, a good physiotherapist will help you strengthen, stretch, and retain your body, so you're not just managing pain, you're eliminating it. Likewise, acupuncture stimulates nerves, increases blood flow, and helps your body release natural painkillers like endorphins. And then there's TENS therapy, one of the most underrated yet incredibly effective pain relief tools out there. If you've never heard of it, TENS stands for Transcutaneous Electrical Nerve Stimulation. Tiny electrical pulses stimulate your muscles, helping them relax. It's especially useful for things like muscle knots, back pain, and recovery after an injury. Finally, what you eat plays a massive role in how much pain you deal with on a daily basis. Because pain doesn't just come from injuries, it's often exacerbated by chronic inflammation. So if you want to get that under control, anti-inflammatory foods are some of the most powerful tools. Fortunately, these are also some of the best foods for your heart. After all, the root cause of heart disease is inflammation. So for more on that, watch our video on the best anti-inflammatory superfoods that can heal your heart. Also, remember to click like and subscribe.